Hello.
Hello, how are
Hey,
you?
yeah, really well, thank you. Thank you so much for joining us. It is incredibly kind of you. We've got a lot of kind of questions to get through, and as always with these things, just not a whole lot of time. So I'm going to get stuck in, if you don't mind, and then we'll, obviously take questions from the audience and everything a little bit later on. So Angie, let's start with you if we can. Consumers have been under unusual stress, which is, I think, underplaying it slightly. With concerns over their own health and safety, especially over the past couple of years. What do you see as some of the major needs then for consumer sort of health and wellness in the US?
Yeah, well, you hit the nail on the head when you said that we've been under a lot of stress. I think it's easy to see and easy to say that mental health and mental health needs, that is the number one concern that we have right now in the US. But think about what we've gone through in the last couple of years. Global pandemic, right? No small thing that we all had to endure, and all of us for the first time. I mean, the last time we had to deal with something like this was 1918. I wasn't around. I don't think anyone else was around. So we don't know how to deal with these new things. And then we had a very heated election. We had racial injustice. We had an insurrection, and now war, right? It feels like so much in these past 2 years has gone on that is new and something that we need to adapt to. And then in addition to that, we're dealing with a country that is getting sicker and sicker, very honestly, and largely because chronic disease and chronic conditions are growing. And people don't necessarily have the tools to take care of themselves in a self-care way, right? We go to the doctor, we get our medications, but what about the root cause of the condition that we have? How are we addressing that? And so that's, as you said, what we hope to solve by offering our Wellvolution platform to our Blue Shield of California members. One thing I just wanted to point out, and this was pretty interesting to me. Yesterday, I read an article about COVID and diabetes, and it said that over the course of 2 years, about 40% of the deaths from COVID were linked to people who have type 2 diabetes. So when you think about the magnitude of that and how important it is to treat the whole person, mind, body, and spirit, it really kind of comes to light in that statistic.
Yeah, absolutely. Fantastic. Thank you very much indeed, Angie. So we've got a really good kind of, I think, synopsis there of the challenge, the problem, and kind of where you sit. We're going to need to sort of try and tell two stories simultaneously and then pull them together. So, Seraj, I want to make sure that we don't just talk to Angie and then, come to you in sort of 15 minutes' time. So let's bring your story into this as well. So, obviously, this is what, Angie's trying to do. Where did Acuity come into this?
So, first of all, we met here at GDS at one of the CMO Summits about 2 years ago. And so thanks to GDS for really making forums like this and bringing community of marketers together with innovative solutions. One of the things that I introduced when Angie described her scenario and the launch of this innovative platform called Wellvolution, which requires consumers to take control of their own health and well-being, essentially, making a commitment to their own well-being, essentially. It was very clear that that's the kind of commitment that's very hard for many consumers to make. You have to decide that this is an important enough thing for me, which I can take control of, and Wellvolution can help me do that. That doesn't happen with a single message somewhere or an ad somewhere. It requires guidance. It requires persistence in the ability to persuade and educate the users that this is something you can now do and you can take control of it and so forth. And that's where Illumin comes in. So Illumin is an omni-channel journey automation platform, as it is called. It's the first of its kind in the advertising technology industry, on which we spent and invested almost $100 million over the past 3 years to be able to map out a consumer journey and be able to deliver the right messages in the right appropriate sequences and test it, essentially a marketing learning lab that we brought, which I described to Angie at the time. And she says, oh my God, it's unbelievable. Why don't we figure out a way to get further communications going with my own team that I have? And perhaps we can go somewhere, at least we can test it. And that's essentially is the genesis of this whole thing. And so we got involved and we did some tests and so forth. And frankly, in a situation like this, I don't want to be the one tooting our own horn in terms of how great we are. I'd much rather let Angie describe what her experience has been working with our platform, working with the team, going through the whole experience and so forth, and seeing the results for her own self, is a much better way to really communicate to the audience that you have here, Adam, in terms of how they might be able to, you know, um, use experiences like this of their own and learn from others who are really doing something similar.
Fantastic stuff. Right, so we've got your healthcare platform, Wellvolution. We've got the journey automation platform, illumin there. So we're going to slowly we're putting the two together, and we will get there. So, Angie, let's go back to you. How is Wellvolution empowering consumers to take control of their own health and wellness? Have you experienced any challenges to consumer adoption and usage?
Yes. So the way that members engage in Wellvolution is completely self-service, which is really great for a lot of reasons, right? There's no doctor referral needed. There's no prescription needed. If they are a member of Blue Shield of California, they can simply go to wellvolution.com and they can sign up for a program. There are certain qualification criteria. So if you enter a diabetes treatment program, for example, you have to be a type 2 diabetic. If you want to join an obesity management program, you will need to have a BMI of 30 or higher, which we then verify through scales and whatnot. But the great thing is that people can they do it themselves. And that's really, really empowering because they don't have to wait for anyone to tell them that they have to do it. Usually people know, I need to quit smoking. I need to lose weight. I need to take care of my mental health. And so to wait for someone to tell them to do something about it frankly slows them down and makes them lose motivation. To your second question, we absolutely do have problems with engagement, which is one of the reasons why we connected with Seraj and with AcuityAds and illumin. One of the hardest things is that as a health insurance company, members and consumers expect you to be there to cover their insurance costs, their medical costs. But this notion that a healthcare company is actually going to care for your lifestyle, your health, the way that you take care of yourself is kind of a new concept. So people don't always know about Wellvolution, and we're trying to do a better job of marketing and connecting our members to the platform, but it is a challenge. And so one of the things that we've done with Seraj is learn more about our customer. Who is our customer? What are they interested in? Well, we found they're interested in meditation and mindfulness. They're out there seeking advice from TED Talks and HealthWise and that type of thing. And based on that, we're able to target our customers in a much better way. And we've begun to see some significant growth as a result of that.
Well, thank you, Angie. And then that's fascinating, Sarah. So you talk about, illumin being a journey activation platform. But actually, it feels from what Angie said, that the first step in that journey activation was the activation of Angie's journey. Was using the platform, I guess, to say, let's discover together before we start doing the marketing too.
Exactly. I think the discovery process overall, whenever you are trying to launch an innovation in the marketplace, there's tremendous amount of, I would say, patience required in terms of learning about what the platform is capable of doing, the kinds of insights it can generate, what are the use cases and challenges, the way Angie described it, that we could address and learn from and so forth. And I think those are all part and parcel of the way the journey begins for a client like the Blue Shield of California. Now, what I will say is that the ability to execute the stages through the journey that the consumer goes through, clearly the journey is a metaphor. It's the mind state of the consumer as it switches from first becoming aware that Velvolution exists, then to know that there are things that it can do for you, and then there are all the other messages in terms of how do you sign up for it and so forth. There are stages there, right? What I would say is that if you look at prior experiences of anything that came before Velvolution in this kind of an environment, right? Any type of marketing that's similar. So, for example, Weight Watchers, which is now called WW, or the AARP members who receive Medicare insurance, but with it, they get lots of fitness training programs and other education programs and so forth, which, like it is in the case of Blue Shield and Velvolution, you don't have to pay for that. And yet, if you look at the rate of adoption for programs like that, they're not very good. Why aren't they good? It's because people require a lot of their own self to believe that this is something that is going to be the right thing for me, and it's worthwhile putting my time and my energy and my effort into it to see the kind of lifestyle change that I'm going to see, and so forth, right? Which is not an easy job to communicate. And that's essentially what Angie's team is essentially accomplishing here, right? Which is guiding the consumer through the process. And the journey is not short. It's not just a week or two, as we've actually learned. And I think, Angie, you have the data and the statistics in terms of what's really happening from our early test, right?
I do. I do. Yeah. So we've learned that the customer journey averages about 43 days from the time of learning about Wevolution to registering for the platform and enrolling in a program. And we do have programs that target different needs, right? So when we started Wevolution, it was June of 2019, we really were very squarely in the cardiometabolic space, type 2 diabetes, weight reduction, um, diabetes prevention and hypertension. And since the pandemic at the end of 2021, we launched our mental health platform. So we're starting to see more and more people join not only these cardiometabolic programs, but also mental health programs, because it's very difficult to do things like lose weight when you're not feeling 100% mentally healthy and whole. So it's really, again, about taking care of the whole person. And you're right, Siraj, it's not something that someone can just sign up for and quickly do. It's a behavior change, it's a lifestyle change, it's a way of changing the way that you look at how to take care of yourself. And that's a tough nut to crack.
So what would it feels like that, you know, this is quite a complex marketing journey that you need to take the consumers on. Can you talk to us about how your partnership functioned in figuring that out? And I don't know which of you would like. Seraj, do you want to sort of pick up what you did on the platform side, and then Angie, maybe you can, you know, obviously you can talk to the education and the messaging side.
Yeah, I think that so much of the research and the thinking was already done on the Blue Shield and the Velvolution side of the marketing, which is Angie's team. What we needed to do on the platform side is, number one, understand whether the assets, first of all, creative assets and the messages were available from how do you introduce Velvolution, how do you educate consumers across the different conditions for which Velvolution is designed. And then what are all the ways to persuade them to want to sign up, right? We wanted to make sure that those messages were in fact available, that the assets were in fact available, and that we could set up some specific sequences on what we call the journey canvas. Just the way you define the journey on a whiteboard, we have a way of really doing it electronically right there on the platform itself. And then the goal is to test. There's a lot of learning that goes on, right? There's amazing amount of optimization that goes on in tweaking and changing and ordering the sequences in one form or the other. Those are all the ways you figure out how you can optimize the learning and the insights. There isn't a marketer out there who doesn't want to learn more, And I will tell you, Angie's team is absolutely ready to absorb anything and everything, whatever they can learn about the way the consumer thinks, what they actually do, how they do it, what are they interested in. I mean, there are just tons and tons of questions that come from the team. And for us, the only way we can do that is by running experiments and tests. And I think that's what really the Learning Lab is all about. Sorry, Angie, yeah, you might want to share your perspective on how it was like.
No, you did a great job, Siraj. I think it's really worth mentioning that there has to be the right chemistry on the between the two teams, and this is something that I think Siraj and I experienced very quickly when we met each other a couple of years ago here at the GDS Summit. That we both had a similar passion for this work. Um, both from the marketing side and actually the human side. Why are we doing this work and why is it meaningful? Siraj's team has been so engaged and so helpful, and we just have worked so closely together that they're almost an extended part of our team. And I think it's really worth spending a minute saying that the way that the teams work together is critical. And then you summed it up perfectly in that we just then had to begin trying some stuff, right? To test it out. And in doing so, the first time that we ran these tests, our cost of acquisition was around $300. Within, I think, about 6 months, it was down to $100 and decreasing, right? Where we keep going lower and lower and lower, and we're getting more and more people because we know who our customer is, right? We know how to attract them, and then to convert them to begin to use the platform. So some really great stuff. We've changed the way that we create content. We've optimized that digital strategy with sort of the media mix. So a lot of really great learnings in the process.
And Angie, could you talk to us about, Seraj mentions, this learning lab, which, sounds amazing. Who doesn't love a sandpit? Who doesn't love somewhere you can go and just kind of play with stuff? But I wonder how it is different from the, your standard kind of test and learn and et cetera, et cetera. Can you share any examples of how it accelerated your learning process?
Yeah, and I think, Siraj, you'll probably do a better job of this than I, because you're so much closer to the illumin technology. I think from someone working with illumin and the platform, the ability to see that customer journey. So where do they start? Where do they learn about Wellvolution? How many times does it take for them to hear about it before they go click on the page? Once they click on the page, what are they looking at? After they're looking at that, what other types of content are they engaging in? And then can we follow them there to bring them back to Wellvolution? So those are some of the things that we were able to see very quickly. And that leads us to more and more conversions, which is essentially where we're trying to go with this, is to grow the platform. I'm happy to say that we are, after now almost 3 years, we have about 100,000 people using the platform, and most of the growth happened in 2021.
Fantastic.
Yeah, let me add to that. In what you were describing, the question you asked was, how is the learning accelerated, right? And I would say that generally, the way marketing programs are run, you pick specific channels of communication, whether it is through video, whether it's through connected TV, whether it's through display, whether it's through social, however, right? The advantage in the way illumin is set up with the journey canvas, the way Angie described it, the ability to visualize communication across all of those channels on a single screen through a single platform is a monumental accomplishment in terms of how fast you can observe what is happening and what's changing. That's where the optimization comes, where we are at a third of the cost of where we started, whatever, a few months ago, right? And so the ability to see, I mean, we can keep talking forever, but the ability to visualize things in how the consumers interact and what behavior changes are in fact happening, and the control over the reach, frequency, and all of that that goes with it, that's where the efficiencies are. And the faster we learn, the faster we are able to accomplish better results over time, right?
And Seraj, curious to get your kind of point of view on that chemistry point, which I think is a critical point, isn't it? For teams to work well together, you need to have a kind of chemistry between them. And I think so often we ask, and I will ask Angie, I will come to you and ask, what makes a good partner? And we're talking about, the solution provider. But what makes a good client, Seraj?
So there are many, many things that make for a superb client that we love to work with, right? I mean, we have tons of clients, but where I personally like to invest the most time is when I see amazing amount of commitment on something that's going to make a huge change in human life. And the way Angie described it, there's tremendous motivation. There is a purpose behind it. We feel so proud, and you've got 100,000 people signed up and benefiting from this platform. Who doesn't want that? I mean, it's a fascinating story, right? And the more people take advantage of it, the better off we are in the society. So that's really the big thing. The second part here is that the incentive systems in this case are completely aligned. The more people who take advantage of it, the more they feel better with the way they are making life and their lifestyle, but it also costs less. It's a less burden on the healthcare system, which is a bigger problem nationally that we are trying to fix here in the US. So this is an all-around huge impact. So how do you bring that about? This is not easy. There are three big things I've noticed here in the relationship that I have with Angie and with the Blue Shield team that's working on Wellvolution. First is receptivity to new ideas. Who wants to admit that they are not receptive to new ideas? Everybody will say, I am receptive to great, give me more ideas, new ideas. The problem is every new idea requires doing something differently. And therein lies the level of effort and the patience that's required to achieve and make the platform and the solution really flourish as it is getting baked, as we are optimizing the things and so forth, the back and forth that is required. There is work required for any type of innovation. The platform itself is an innovation, and the way it's being marketed is an innovation itself. So there is all around, there's new stuff happening. And so a level of patience is required. If Angie would have said, oh my God, 6 months ago, $300 per acquisition, that's huge. I can't do it. Stop it. She could have done that, but she didn't. The team stayed with it. They knew that there was potential here. They knew we could improve it, and working over it over time, we got there. So it does require some effort. The second is this whole close collaboration. Everybody says we love to collaborate. But let me tell you, the part that is the most demanding thing about collaboration is transparency. When something doesn't work, the ability to say, it's not working, that takes a lot of courage, both on the client side and even on the partner side. The ability to say, okay, if this isn't working, let's think creatively, let's brainstorm. What could we do differently? And I think that's the mentality and the chemistry and the culture that we have between the two teams, which I absolutely love. It's fascinating. And then finally, that point I made was creativity. And I mean creativity with a capital C. The client is doing many, many different things in terms of creative assets and the videos and the depictions and the messaging and everything they're creating. Absolutely, that is very helpful. But it's also about broadly creative, about what are the alternatives that we could explore if something isn't quite doing, and being maniacally focused on improvement. What can we do better? Every single time we talk, there's always the question from the client, hey, what can we do better? Where can we now, improve on this angle or that angle? Is it a different audience? Is it the way we are using the data? Could we use the first party data? Could we use CRM matches? Could we do this? Could we do that? I mean, there's just an endless communication in terms of where we can really go together, join hands and make something better here, because we feel that the more people we bring on the platform, the better off we are. And it just makes us feel so much good about what we are doing together. Angie, your turn.
Well, I don't know how to follow that. That was really, really concise and really good. You summed it up well.
Shall I give you a
I
question,
really
Angie?
like, yeah, I mean, I really like what Siraj was saying about understanding the product. And in our case, um, we have a lot of passion for it. We really do. And when I say we, I mean my team at Blue Shield of California. They're not just marketers; they're marketing a product that they love. And so having a partner that really understands that sort of the passion and perseverance, the grit that goes into making that come to life, that's huge. We need somebody who really truly gets and understands the value proposition, why this is a differentiator in the health insurance industry. And so that's something that we really found with Siraj and his team. And as I said, our teams work so well together. Siraj, the creativity, the different things that we're testing, the different channels, all of that fosters this exponential growth, which is essentially where we want to go with Wellvolution. We want every single Blue Shield of California member to want to use Wellvolution in some form or fashion. And that's where I see us going. So I put an exclamation point on everything Siraj said, and just really excited to see where this partnership goes.
Fantastic stuff. I just want to go back to the first thing Siraj talked about on his list of three, which I think was around sort of just the amount of ideas. You know, who doesn't say that they love a good idea, but there's sort of 1% inspiration, 99% perspiration kind of piece. And I remember speaking quite a while ago now to the CEO of Lego at the time. And Lego was in a lot of trouble, and he kind of turned it around. And we were talking about how he managed to do that. And he said, it's a complete misnomer. Companies do not die of starvation. They die of indigestion. They're trying to do too much stuff. So I'm wondering then, Angie, how, when you've got this amazing platform throwing up all these amazing kind of facts and data and everything else, I guess I'm wondering, number one is how do you decide which are the most important bits in there to keep going towards that North Star, to keep going in the right direction? And then number two is, what are the kind of the hard metrics that you put around this stuff? Because the creativity, the ideas, and all that, sounds like the team get on brilliantly. But there has to be, for you, there have to be results here. So I'm wondering, how do you measure it? How do you prioritize it?
Yeah, well, at the end of the day, we do have a finite budget, right? We don't have endless amounts of energy. We don't have endless amounts of resources in terms of how much we spend. So the number one metric that we're looking for is cost of acquisition, because we need to make sure that the amount of money that we're spending is going as far as we can possibly stretch it. So whether we are doing search ads or YouTube videos or Facebook ads or search optimization, whichever one of those we're going to do, whichever mix of those we're going to do, it has to lead towards a lower average cost of acquisition. And I think that there's a healthy mix of, okay, what's kind of our cash cow? What's our bread and butter? What is the one thing that we can do where we can get the most amount of members for the least amount of money? And we do that. And then also, what is the coolest, the newest, the most innovative, the most fun? Let's try that out. We always are trying out something new, something new, something new, because that may at some point become our cash cow. So it's kind of that healthy mix of bread and butter and innovation to decrease the cost of acquisition and make it manageable for us against our budgets.
And Seraj, I mean, everybody needs a constraint. Necessity, as they say, is the mother of invention. That feels actually like a pretty solid constraint, isn't it? This is what we need to get to, lowest cost per acquisition. This is the budget. How did your team respond to that?
Yeah, so it's always good having very specific, what they call KPIs in marketing, always help, because we know that the economics are going to have to be justifiable sooner or later. The cost per acquisition ultimately has an impact on exactly what the other end of the benefit is in terms of the cost savings from healthcare and insurance and payouts and what have you, right? And those economics are done by Angie's team. Frankly, we don't get that close to that behind the scenes, what they do. What we do have to do, though, is we have to make sure that those economics of the cost per acquisition improve over time. And the challenge in marketing doing that, the way Angie described it, it's all about channel and a portfolio of media mix that you need to be able to optimize. No single channel, no matter how cost effective it is ever going to drive most of your acquisitions. It just doesn't happen that way in marketing. The acquisition channels saturate relatively quickly. And so what you want to be able to do is you want to diversify reach and the diversity of audiences and what will be the right incentives for them and where they want to go consume content and so forth and interact with media. You need to be able to have that diverse reach. But then once you get them, what is the optimal path, as they call the optimal journey to convert them and to get them to register? That is where Illumin comes into the picture, wherever they are coming from. Ultimately, once they are exposed, you want to find the most efficient way to get them to convert and register with the platform. And that is where the platform does the most significant job here in this case. So you think of this as people are coming from all over the place into a single destination somewhere, but they aren't quite there yet to what we want them to do behaviorally. So how do we do that? Do we deliver 3 messages? Do we deliver 7 messages? Do we deliver 2? And which 2 of those messages are critical? Is it a video and then a display? Is it a video and then an audio? Is it audio and then a native video? What combination of those things are the ideal from the economic point of view? That is a crazy challenge which no human should be responsible for managing. That is what algorithms are good for. That's where AI comes into the picture. You know, we hear about AI and this, that, and everything else. Well, this is a simple choice algorithm. Of all the choice of messages I can deliver to you in the next couple of weeks, what is the ideal choice of messages and channels through which I can persuade you to become a member of Valvolution? That is the challenge that Illumin was signing up for. Now, could a human do that? Imagine a human doing that. This is a combinatorial algorithm which no human should be responsible for ever doing. That's what computers were built for, and that's what Illumin does.
Fantastic stuff. We are to time. Thank you very much indeed, Seraj. Thank you, Angie. Much appreciated. It feels like a good place to leave it. Have a great rest of the day, a great rest of the summit. I'm so happy that the GDS has played a tiny, small, but but kind of valuable part in the success story. And the very best luck with Evolution. Obviously, Angie, it does sound like you're doing great work there.
Thank you so much, Adam.
All right. Thank you, Adam. Appreciate it.
Take care.
All right, bye now.
Bye-bye. Thank you.